Hello and welcome to Senior Spot. So delighted to have you join us today to be able to learn some tips and tools that hopefully will help all the seniors in our community. Today we have a special guest. Her name is Karen Halloran, and she is the community liaison for Care One at Lexington and Care One at Concord. Welcome, Karen.
Thanks, Jen. Thanks for having me on the show today.
Well, I'm really delighted because I know that there's been a change in the name, and so I'd love for you to explain a little bit about that because I think there are probably some viewers out there that might have some confusion. So please clarify it for us.
Sure. Well, the name change has been from Lexington Healthcare Center and Concord Healthcare Center to Care One at Lexington and Care One at Concord. And the reason for the change is the parent company is out of New Jersey, and they have all along been Care One. So people were getting confused. We have 15 facilities in Massachusetts, and so we're all now known as Care One at whatever the name of the town is.
Okay. That certainly makes it a lot easier to be able to remember. And,
I think so.
And that's good to know because I think that a lot of people for a while are going to refer to it probably still as Concord Healthcare Center, Lexington Healthcare Center. So we want to make it really clear that it's the same great place.
Exactly.
But it's now Care One at Lexington and Care One at Concord. Okay. All right. That was one of my big questions. So Karen, you are the community liaison for both facilities.
Yes.
And I'm just wondering, I always find it interesting to know what brought you into this role, into this profession. Could you share with us a little bit about that?
Sure. Well, right out of high school, my first job was working at a nursing home. It was working at Neville Manor, which was run by the city. It's in Cambridge. And I just always loved working with seniors. And from there, when I went to school, I got my degree in marketing, and that brought me back into healthcare.
Excellent. Great. So obviously that had a long-lasting impression on you.
It did.
To be able to work with that community. So, I'm just curious about, the specifics about Lexington and Concord and the two sites there. And, seniors, it's a rehab. So tell us a little bit about what is a rehab? What do you offer there?
Sure. Well, they're both skilled nursing facilities also, but then we do have the component of rehabilitation. So at both of them, people would come for, maybe they've had a hip replacement, a knee replacement, joints, cardiac rehab, respiratory rehab. So they would come for a variety of reasons. If they've had an accident or surgery, and they would come for a stay.
Wow. So that it kind of runs the gamut of many different things that you cover in terms of care. So I look at it and think, some things are planned, some things are emergencies. It's always great to be able to plan, but things happen. So could you explain a little bit about how you handle planned maybe procedures at Care One Lexington and Care One Concord, and then I want to find out about the emergencies as well. So just share a little bit about the planned procedures.
Absolutely. Well, I would like for people to know that they can pre-tour and they can pre-book. So if somebody knows next month that they're going to be having surgery, they're able to come in, take a tour, and they're able, to let us know. Maybe next month they'd be available to come into our facility 2 days after they're going to have their surgery. They usually know around the time frame, and we'll be able to hold it for them. That way, it's an emotional time and stressful time anyway after having surgery. That takes that out of it. They'll know that they have a place to go. They've already seen it. They'll feel comfortable.
Sure.
And to know that they have a choice. That's what I do is I let people know. Seniors sometimes will not know that they have a choice to go places. They should be given a few places to choose from. That way you could tour before. And there are a lot of great places out there. We would love for them to come to Care One at Lexington or Care One at Concord, but to know that they do have a choice.
Good. I think having a tour absolutely makes a difference. I'm a big planner. Lots of people like to be able to know what's going to be expected. So what types of things do you need to do in preparation? So besides coming in for a tour, do you need to talk with your primary care physician? Do you need to coordinate in that way? What types of other plans do you need to put in place?
So they would talk with their doctor, and the doctor would probably, if they're going to the hospital, are familiar with our place. So then they would talk with our admissions director, which is Judy Gutierrez out of Concord, and Ruth out of Lexington.
Okay, great. And that will be important as we look at maybe the different things that are going to be panned on the screen. You'll have the website up there so people can then reach out to either one.
Exactly.
Okay.
And then they would make sure that their insurance would cover. Usually Medicare will cover for a stay. If not, they may have a private insurance. We do take different private insurances, or people could also private pay.
Okay. That actually brings up a great question is, how do people pay for rehab? So you bring up 3 different options in which most people will fall into one of the 3. So could you go into a little more detail about that? Because especially if it's a planned procedure versus an emergency, if it's planned, how do you get all your ducks in a row?
Right. Well, we do have a hospital liaison, which they would meet at the hospital. So that person would go to them and they would review their chart and screen the person to make sure that it is an appropriate place for them to come. Then they would deal with the admissions person. We would make sure that the insurance would be covered. So we would let them know. They would give us their card and their information, whether it be Medicare or Tufts or some other private health insurance, and we would make sure that it would be covered. If they were going to be paying privately, they would have that discussion also at that time.
So I know firsthand from clients that we help and we assist that you have some incredible social workers at both locations, and part of their job and their role is to help with making sure that things are covered. So that's a big help to people. It's a very confusing arrangement many times. Who's paying for what? It's overwhelming, as you mentioned already. So part of their role is to be able to see if they qualify for different things. Is that correct?
Correct.
Okay.
Correct.
All right. And then we'll get into the discharge planning in a little bit because, we're talking about how you get in. It's on the other end, how do you then transition out? But I'm still curious. I still have a few more questions about the going in part. So we talked about planned procedures and having that option of being able to tour and being able to become familiar with the environment and have a heads up on what might be expected is helpful. But emergencies happen. So unfortunately, we're coming upon a winter, and we've been lucky so far with the weather, but that usually results in some falls no matter what age you are. So can you explain a little bit about how the emergency situations, how someone ends up at Care One Concord or Care One Lexington based upon an emergency situation?
Sure. Well, there are screeners in the hospital. So our screeners, hospital liaisons, work 7 days a week. So if somebody did have an emergency situation, the screener would be able to see them and assess the situation. The hospital would call our screener, and we're able to do an admission 7 days a week. So as long as the person was appropriate, they would be able to come. They would set up for them to come over to our place, and nursing would be prepared to have them come in. And we do have therapists 7 days a week also, so they would be seen.
Great. That makes a big difference because, it's not a Monday through Friday. It's certainly a 24/7, 365 days a year need.
Exactly.
So that's very good to know that in the hospital and at both locations that there's always 24/7 oversight and help available. I think that's important for people to know. If they're going to be leaving their home and having to be in a situation, they know that somebody's going to be there and caring for them. With emergencies, how, I guess obviously it varies per person in terms of how quickly they move into a rehab situation. So, when someone is discharged from the hospital, what's the next step? What happens so they obviously are screened, they get to meet the liaison, they've decided, okay, I think that Care One at Concord or Care One at Lexington, those are good options for me to go and have rehabilitation. So what happens from that point? Okay, we've decided where we go. So then how does that next step happen? How do they end up there?
Well, then they're usually transported by ambulance or a chair car.
Okay.
And they would come to our facility, and nursing would be prepared and ready to meet with them. And they would meet with the nursing team, and they would go over all of their problems that they're having right now and their medications, and then they would be screened by our rehab department. And we have physical, occupational, and speech therapists. They are employed by Care One, and they're there 7 days a week. And that's a little bit unique because a lot of places do not have that. So they're going to have that continuum of care. They're going to see the same therapist, which they're going to build a great relationship with. And I think with that comfortability factor, it makes for a better recovery and a quicker recovery.
I absolutely agree. And I know that people become very attached to their physical therapists, and it must be so hard for the PTs and the OTs and the speech pathologists to have people go home, but such a rewarding gift to be able to give people their, all the skills they need to be able to go back home. So you mentioned, different areas and different specialists, and I just wanted to piggyback a little bit on what you said about them being Care One employees versus notes. How is that different? Because I'm not sure everyone would understand the difference between that and then how other rehabs might facilitate the therapy.
Other people sometimes have a contract, so they would have an outside agency that would come in, and that would be different therapists that they would be being seen by. Okay. Ours are employed by Care One, so they're there. They're going to have the same people 7 days a week.
Well, that definitely makes it unique, and I think much more comforting in a situation which could be scary and overwhelming and all of the above. So we've talked a lot about the seniors and about how it's impacting them and sort of the process that you go through, either planning ahead or an emergency situation. There's a lot that goes into supporting the families. Yes. So can you talk a little bit about how the staff there and the employees help in supporting the families? Because we need the help too.
Absolutely. Well, discharge planning starts from day one. The social workers get together and there are care plan meetings being held. The families are included. They're certainly welcome to attend along with the patient, and they go through some of the different things that they're going to be doing. And so they're kept in the loop in anything that they want to add to it. They're included in the plan, which I think makes a big difference. They feel more comfortable, I think.
Absolutely. And having sometimes your patients need a voice from their family members, and other times they don't. And I think sometimes we want our family to be participating in it, and sometimes we don't. Sometimes it's appropriate, sometimes it's not. I like the idea that there's the choice there, and that each patient would have an opportunity to make that decision for him or herself, and whatever's suitable.
We do have other departments too that are involved.
Okay, so social services, which I know is phenomenal.
And they're great. They are great. And then we do have dietary. And our kitchen, they really go out of their way to, we have a nutritionist also. So as long as it's on their diet, the dietitian, they'll review their plans, and they make accommodations. They make sure that people like the food. And they really go out of their way. They've been there both for a long time. Then we also have activities department. So people aren't bored there. There are lots of activities and things for them to join in. Great. And we have people that come in and perform and do different things. They have arts and craft type of things that go on. They have different civic organizations that will come in.
Oh, great.
And they have a lot of great things.
Great. So whether your stay is going to be short or whether it's going to be long, it's going to be
activities.
Great. I know that with looking at a skilled nursing facility, which now is also known as SNFs. A lot of people will refer, so we just going to throw that out there, we have to have the lingo. So skilled nursing facilities, you mentioned your first job was in a nursing home, and so people are probably trying to say, well, what's the difference between a skilled nursing facility and a nursing home? So I am fully aware that there's short-term, there's long-term, there's some memory support. Can you describe each one of those sort of wings and areas that Care One at Concord and Care One at Lexington both encompass? Okay.
So skilled nursing facility, they would need certain criteria to meet that. And people would either be qualified with Medicare or Medicaid or private pay. They would need a nurse there. They may need medication. They may need different services. They're not able to perform activities of daily living.
Okay.
So they need help with a lot of things. It's usually after they've gone to an assisted living, maybe they can no longer be cared for there. Okay. They may need different things.
So that would be considered the long-term unit, the long-term residence that you have there, where people, that is their home.
Exactly.
And I like that the motto of that, we're visitors, in their home. That's their
Exactly.
new home, and to make them feel as comfortable as possible. And that's why the activities and having all that involvement makes a big impact in their quality of life. So that's your long term. Now, short term, so obviously the definition of short is brief,
Right.
which is, it's all relative in terms of what people might consider would be brief. So can you tell us about a typical stay
Sure.
for short term?
Okay. Well, Medicare will typically pay for up to 100 days. But what we're
That doesn't seem
finding,
short to me.
no, that doesn't. That's not short. But if somebody needed that, Medicare would, as long as they're making progress and they're not plateauing, would cover it up to then. What we're finding is people are typically coming into our short-term rehab and staying about 2 weeks.
Okay.
They're coming in for a hip replacement, knee replacement. Maybe they've had cardiac surgery, some respiratory. We're finding a lot of COPD.
Oh,
People
yes.
coming in for things like that. So they're coming in, they're getting the rehab they need, and then we're making sure that they go home. The goal is to go home.
Absolutely. Everybody likes to go home. Now, I know that you have different programs that are in place that do help people make that step to go home, and I believe it's called Next Step
It is.
Home,
It is.
ironically. So, can you tell us a little bit about this special program at Care One, at Care One Lexington, at Care One Concord? What is this Next Step Home program?
The Next Step Home is a room that we have dedicated for people to actually try out and simulate going home. So 24 hours, at least 24 hours in advance before going home, they would go into this room and they'd be able to try everything from eating and getting up from the couch and using the bathroom and seeing also, nobody's going to be home to say, okay, it's time to take your medication. They would have to go out to the nurse and call for the nurse and say it's time for me to take my medication. So I think it gives people a lot more confidence going home, and it also shows maybe there are some things we need to work on, before we're sending somebody home that isn't ready to go home. But
Absolutely. And I think having confidence where it's the patient that's confident, it's the family that's confident,
Exactly.
and the employees, the staff, the professionals, you feel confident in having someone return back home if they're truly ready. I've seen the different, rooms, the simulation rooms, and it's fantastic. I mean, you have a kitchen, you might have a washer and dryer, you have, like you said, a sofa, all the things that we interact with physically and even mentally, steps and taking, sequencing and making sure that you can do things in a certain order, like going in to use the bathroom. You need to be able to do step 1, 2, and 3 in order to get yourself in there independently. So I've seen these, these mock, homes, and I think that is such a spectacular idea. How else would you know if someone's ready to go home or not?
Exactly.
And it's also something that might be reassuring to families that may not think somebody is ready to go home and maybe very strong-willed and very opinionated about it. I don't think mom or dad or my grandmother or grandfather, I don't think they're ready to go home. So this program, the Next Step program, enables family members also to see that indeed someone is ready to go back home.
Absolutely.
I think it's important.
Some of the other things they'll do, they'll review what do they do at home. Maybe someone irons, so they have an ironing board set up. They'll
They
fold
wouldn't be
clothes.
doing that on my checklist if I was there. Ironing is not under my.
They'll fold clothing. Everybody does laundry,
Sure.
mostly. They have a refrigerator, so they'll have a mock pantry, and make sure that people can actually put the items in off the shelf into the refrigerator.
Absolutely.
Things like that.
Sometimes just getting the groceries from the car into the house and then into the pantry or the cabinets are going to be the biggest challenge. It's not necessarily going to be the cooking piece.
Exactly.
It's going to be those, things that we take for granted. So I like the idea that you're customizing it to each person's lifestyle, because everybody's a little different. Like you said, I certainly wouldn't be the one that would have the ironing on there. Bringing in the groceries, absolutely. I'm always lugging in the groceries. So I like that it's individualized for what the person needs, and that covers age too. So, can you talk a little bit about the range of ages that you have there? I think sometimes people envision certain demographics, certain ages. So can you speak a little bit about how
Sure.
it's involved?
Well, with all the changes in the hospital, there are goals for the hospitals to either get people to a skilled nursing facility, a rehab, or to go home
Okay.
quicker than in the past.
Right.
So we're finding also that the age demographics, people are a lot younger. We've had people come in that are in their early 30s or 50 up until 85, 90.
Right.
So there's a wide range now. It's not just known for people that are old to come
Okay.
in.
Well,
There's
yeah, I
not
think
a set age
that's
any
important
longer.
for the community to know because, I have observed that in being in the different buildings and different skilled nursing facilities, and it's not an anomaly. It's something that really is a trend, and you're right. A lot of it has to do with the hospitalization, how long the stay is, and then trying to move you through to get that step closer to being at home. So it's good for people to know that it's not age restricted in terms of when you can actually be
Exactly.
there.
They should probably also know, too, that we have a separate dedicated unit. So the rehab is not integrated with the skilled nursing.
Okay.
They're on separate floors.
Okay, that is good for people to know because people might have a certain comfort level. Some people think that if they go someplace, they may not actually be able to leave.
Right.
And so having a separate unit might make that person feel just a little bit more comfortable in being a temporary resident
Exactly.
there. So I'm just thinking more about specializations. If you could pick one specialization that you are wowed by in each facility. So at Care One at Lexington, what to you just says, wow, this place is really spectacular. I am so proud to be a part of it.
I would say probably the physical therapy part of when people are having hip and knee replacements. We seem to have a lot of people come for that. Not that we can't handle other things, but I see a lot of people doing work with that.
And that would be younger and younger. Talk about the
Exactly.
younger demographic. I have friends of my own that in their late 30s and early 40s have had replacements. So that really reaches a broad range.
Absolutely. And we have all kinds of modalities there. They can do E-stem, they can do...
Tell me what E-stem is. I'm not even sure what that is.
It is a ultrasound that actually goes through and will help to relax the muscle.
Really? So sometimes it might just be that someone's like uptight and they might not be relaxing.
Exactly.
And that might be
Exactly. And it's
prohibiting them from progressing. Wow, I never even heard of that.
Yep.
See? You learn something new every
And
day.
they can do ultrasound. We have ultrasound there. And they do a lot of different things.
So you don't have to go off-site for any of those needs.
Correct.
Oh, that's great, because the less change, the less transitions, the better off people are going to be. All right, so
And then in Concord,
yes.
I would say we can also do those things there, but we do respiratory rehab and also cardiac.
Okay.
And we see a lot of that there.
So what's respiratory rehab? What does that mean?
Somebody may be coming in because they have COPD. We're seeing a huge increase in rise in the population of people being diagnosed with COPD.
I find that too as well in my company and with our clients that seems to be sort of a something that comes hand in hand with other things, but that seems to be popping up a lot in assessments.
And then different equipment that they may need to get used to using before they're going to go home. Maybe oxygen or a CPAP machine.
Okay.
And we also have oxygen and suction right on the wall there. So it's like a real acute care setting.
Okay. And that's a good word to use because I think that that's something that's either misunderstood or misused. So when you say acute setting, it's important for people to know that is available there. So you said respiratory and
cardiac.
And cardiac.
We do have a lot of people that maybe have had a heart attack or have had heart surgery and are coming there to recuperate and do the different
And what
things.
types of recuperation? I mean, besides healing just naturally and resting and following the doctors and the nurses' orders per se, what kind of rehab does it take as far as cardiac?
I think also with physical therapy, they're going to need to, be able to walk a certain amount.
Okay.
They're going to need occupational therapy. They're going to need to get their strength back in order to go back home.
Okay, so it's really strength building and
Sure.
maybe showing them some different things that maybe they had not addressed or perhaps they didn't make a priority.
Correct.
So, I mean, there's a lot of learning going on. It's not just,
Right. A lot of education is taking place with them.
and that's great. So I'd love for you to share a success story, So can you share a success story? It could be in either site, you know, in any one of the areas, respiratory, cardiac, replacements, a success story that you're very proud of.
Well, we had a rehabilitation reunion. Yes, and that's something that we like to do because people really develop great friendships and bonds while they're doing rehab.
Sure.
So
they keep each other going.
They
You know, they
do.
root for each other. I've seen that
Exactly.
myself with clients
Yeah.
that, you know, they're friends that they've made. They're disappointed that they're leaving, but so proud of them, and they've kind of cheered them along.
Exactly. And the therapists and the assistants get really attached to them.
Sure.
And they really become like a family. So we had this rehab reunion. We had about 30 people return.
Wow.
And we had a luncheon and just recognized them, and everybody got to see each other. And there was this one gentleman that I conducted a little interview with, and he had a picture with him. And he had fallen and broken his neck.
Oh.
And he was in a halo.
Wow.
So he couldn't even barely walk when he first got there. And just the progress that he made, he was with us for a while, and he was able to return home. And he was walking and just really had great things to say about his recovery. So I would say that would be a great one.
That speaks volumes for a few reasons. Obviously, the progress that he made, but that he wanted to come back and he wanted to share that success because it was part of, you know, part of the doing at Care One, either at Lexington or Concord, whatever site that he happened to have been at. That's a wonderful gift to be able to, you know, to be able to let others know, because a lot of times you leave and you never hear from somebody. So I love that idea of a rehab reunion.
Exactly.
That's a great idea. So I just want to recap that Care One at Concord and Care One at Lexington were previously known as
Lexington Healthcare Center and Concord Healthcare Center.
Okay.
And now known as Care One at Lexington and Care One at Concord. And I should mention also that we do have a certified Alzheimer's unit at Care One at Concord.
Yes.
So we do have that also.
Which is wonderful because sometimes people might go in for one reason or another, and to have one less transition and be able to stay a part of that community could really make a big difference.
Absolutely.
So we're saying we have a new name, but the same great service and the same great options for people.
Exactly.
So, well, I would like to thank you very much, Karen, for coming and representing Care One.
Well, thanks.
And congratulations on the new name change. And we're so pleased that you help people in the community. Thank you so much,
Jen.
Karen.
It was great to be here.
All right, take care.
Thanks.